Hi, everybody. Welcome to our webinar, Moving Forward with Your Financial Health, Building a Family After Cancer Treatment, Part 2. My name is Samantha Watson. I am the Executive Director of the SAMFund, and sitting right next to me is Michelle Zietler, our Program Director. Hello. And also joining us, who I'll introduce in a moment, is Penny Harrison from MSPCC's Active Love Adoptions. Just a few quick notes before we get started, and then we'll jump right in because we have a lot of information to cover in the next 60 minutes. But a quick note about our webinar. For those of you who haven't participated in webinars before, basically you'll just be hearing us talk. Everyone is on mute. So you'll be hearing either myself or Penny or Michelle, and on your screen you'll see a slideshow, basically like watching a PowerPoint. It will be available on our website afterwards for anyone who either wants to refer back to it or for anyone who's not able to participate live but wants to view it afterwards. And if you have questions throughout the webinar, you'll see a box on your screen where you can write them in, and Michelle will be on this end fielding the questions, and will either pass them along to Penny during the presentation, or Michelle will respond to them during the presentation, or we'll follow up with you afterwards. And if you ask a question that doesn't get addressed in the next 60 minutes, then certainly we'll follow up with you over email and do our best to help you get your questions answered. So the last note about the webinar itself is that we just ask anyone who's watching this or participating to take a couple minutes to fill out the pre-webinar survey if you haven't already. And we noticed, for those of you that did fill it out, we noticed that there were a couple of questions from people who had fertility-related concerns, and so who had questions about IVF or donor eggs or donor sperm. And those actually won't be addressed in today's webinar, but we did a webinar 2 weeks ago with Joanne Kelvin and Mindy Berkson on, it was actually the first part in this two-part series on family building, and it dealt with all of the biological options for family building. There is a recording on our website, www.thesamfund.org/webinar, so definitely check it out when you have a couple minutes. Actually, when you have 90 minutes. It was a longer webinar because we had two presentations in one, but that is available for you to check out on our website. And the last note is really just a plea to each of you to please complete the post-survey, the post-webinar survey, which will be on our last slide at the end of this presentation, will also be emailed to you. And for anyone that participates in the webinar and watches it after this, please check out the link and take a couple minutes. Those surveys really are very, very helpful to us because they help us ensure that this webinar series is as helpful to you as possible, that the presentations are as clear as possible, and that we're addressing the topics that you need some guidance on. And so it's really just for our own knowledge. Everything is kept confidential, but we really do rely on your feedback to continuing to ensure that this program is as effective as it can be. So with that, we will start this presentation, the second in a two-part series on building a family after cancer treatment. And this is a topic that, hands down, was one of the most commonly faced challenges among the young adult survivor population. We get asked questions all the time on it, so much so that we dedicated not one but two webinars to it. And this particular presentation is going to focus on private domestic adoption and foster care as two options for building a family. We're very, very thrilled to have with us Penny Harrison as our presenter. Penny is the director of MSPCC's Adoption Services here in Boston, Massachusetts. She runs Active Love Adoptions, and she has 20 years of adoption experience, specializing both in public sector child welfare and domestic infant adoption. She's currently the director of MSPCC's Adoption Services, which provides both pre- and post-adoption support to all members of the adoption constellation. And she'll explain what all of that means. But suffice it to say, adoption can be a lengthy process, can be a costly process, and it's our hope that through this webinar you'll find the information and the resources you need to be able to pursue it if that's your choice. And if you have questions, again, please feel free to IM them to Michelle during the presentation. And Penny, on behalf of everybody at the SAMFund, I want to thank you for taking the time to do this presentation and welcome you.
Well, thank you, Sam, and thank you, Michelle. It's my pleasure being here today and being able to deliver this information regarding adoption. And as Sam had said, I have 20 years of experience. I don't have a personal connection to adoption. All my experience has been professional. So hopefully this presentation will be able to sort of distinguish between the two types of adoption here and the process and how really being informed is going to make all the difference in the world as you sort of navigate the world of adoption and start your journey. So thank you. And that's just
yeah, Penny, you just have to click to show my screen so that we can all see your slides.
Okay. Oops. Can you see it now? I think I just. Oh.
There we are.
There we go. Right. And that's one thing I'm not good at, technical. Okay. So there's who I am. One thing is my screen is getting stuck here. I apologize. It doesn't seem to be moving.
No problem. I don't think we've actually had one webinar so far that has not had any technical difficulties, so you're not alone.
You can see your mouse moving.
On my side, it's stuck on the screen.
There might be something that says view a slideshow or start slideshow. Could that be?
Not here. Let's see. I apologize. I don't see anything here.
Maybe we should, Michelle, what do you think, close it and start?
No, we shouldn't have to restart. Penny, try hitting escape and see if that makes it back to you.
Okay. All right.
You may just have a frozen PowerPoint.
Yeah.
Which happens. It happens sometimes.
Let's see. Oh, here we go.
Oh, wait.
Are we good?
Excellent. We're good.
Sorry.
No problem.
First part of the presentation I'd like to focus on is the private domestic adoption. And I think when you're going through this process, it's important to know sort of the time frame that is part of the process. And again, it's going to vary from state to state. It's going to vary from the type of adoption you choose. In private agency-facilitated adoptions, the wait tends to be a little bit longer. In independent adoptions, where you hire an attorney, or what I'm going to talk about in a little bit as a facilitator or a mediator, the process can be a little bit shortened. But on average, timelines are anywhere between 6 months and 2 years. And that statistic was taken right from Adoptive Families, which just had their 2012 report. So it's pretty current. Those are the wait period before you are actually matched with your child. And again, some of that has to do with the size of the agency that you choose to work with. Sometimes it has to do with geographical regions. Again, sometimes it tends to be on, what type of agency you decide to pursue, whether it's an agency-initiated or you decide to go with an attorney or a facilitator. And so I think what's important is to really figure out what is, and we're going to talk about this in a little bit, but what is your budget? Because agencies tend to be nonprofit status, meaning that they're going to pretty much all be within the same ballpark figure about how much an adoption is going to cost a family. Versus if you choose to work with an attorney or a facilitator, and a facilitator is anyone that is sort of involved in the adoption process that may not be directly related to the agency or related to an attorney, but sort of will negotiate and will identify potential placements on a family's behalf. So sometimes they can be attorneys. Sometimes they can be, in other states, they can be social workers or sometimes these facilitators who may not be making any money out of the process may be clergy people who are then, networking on a family's behalf. But if you choose to use a facilitator, most of the time they tend to be for-profit entities, just as attorneys are for-profit entities. So they can drive up the price of an adoption. But in a ballpark range, what we say is it's about $25,000 to $40,000. And that's just your ballpark range. What we know is that the more people that are involved in the process, if you do have to pay a facilitator, sometimes that price tag can go up to about $70,000. We've seen some very expensive adoptions as of recently that families network with a facilitator and may not have a placement on the first time. And so again, all those things are called financial risks that can be associated with adoptions. That I think it's important for families to know is that when you go through this process, that you're going to need to ask those questions, and you're going to need to do the work beforehand to figure out what is your budget, and what kind of financial risk and what kind of emotional risk are you really willing to take, because adoption is absolutely an emotional process, and there's a lot of things that are unfortunately outside of the adoptive parent's control. And so I think sort of structuring yourself and understanding what your bottom line is as far as your budget is going to be, excuse me, is going to be very important. So I hope any questions or anything that it's to understand the three separate processes involved in that is kind of difficult. This is just a sort of an overview. But I think there's a good website here that I've linked about sort of figuring out which route a family needs to take will be very important as far as figuring out how you get connected next.
And actually, Penny, if I can jump in here for 1 second, because you just reminded me that there was something I did want to say at the beginning and forgot, which is that as part of this presentation, you're also going to be addressing not only this issue of cost, but presenting some resources for how people might finance this. So I know at the start of this webinar, that's probably a huge figure for any participants who maybe had no idea what the cost of adoption was. But rest assured, for those of you who are listening to this presentation, we are going to cover that as fully as we can and try and point you in the right direction in terms of how you can finance it, organizations or other resources that are available to help you. So don't fret, stay with us.
Yes, they say exactly. And I think another piece, too, that I just want to reference is that the majority of domestic adoptions today are really independently facilitated, which means that families are being connected with expectant parents through internet, through facilitators, through attorneys, versus going sort of the traditional route of going to an agency and starting the process that way. So that's just important to note. And in some states, independent adoptions are illegal. So in Massachusetts, for instance, we are an agency state, and so all adoptions must go through a licensed child placement agency. But that's not the same in other states. So just to recognize that as well. Okay, for the private domestic home study process, from pre-application to approval, I think what's really important is that after you figure out which route is going to work for your family, whether you choose an agency or you choose an attorney, is that initial contact with the agency or the attorney is a piece of this process that you really can control. And I always tell potential families who are coming to sit down with me that that they need to feel comfortable with the agency that they're working with, because this is not just a moment in time. You need to feel confident that we will be there for you, and that that this connection will be fostered through the life of your family. So it's very important when you're sitting down and you're speaking with an agency or an attorney. Most agencies will offer complimentary meetings with the director, so you can sit down and ask all your questions about, agency specifics, like how many placements do you do a year? On average, how long are your families waiting before they're matched with a potential placement? Are you, where do you find your expectant parents? So those are all really good questions to ask when you're interviewing a potential agency. And I think what's important is that that you are as transparent as possible during this process. So I want to underscore, do disclose your medical history. And ask any questions that you may have. So maybe you're concerned about how this information gets shared or how this information is going to be used. So those are really, really good questions to share at that initial appointment with that director or that attorney. And hopefully whoever you're connected to will be able to share with you exactly how this is going to impact the process. As I said, I encourage you to be very transparent right from the get-go, because you don't want this information then being later shared when the time comes when the home study started and references start to be gathered, because then the agency is sort of thrown off. So as I said, to just be very honest and forthcoming in the beginning stages. Information that's really key that must be gathered prior to beginning a home study, and all agencies do it differently. Whoever does your home study, they do it differently, but one thing that we know that pretty much is consistent in every state is that they're going to need to take an application from you, and they're going to need to do a series of background checks. In Massachusetts, we do a criminal background check. We do what's called a central registry, so we want to make sure that you've never been named or accused of abusing or neglecting a child. And those happen in every state that we want to do these. We do FBI checks. In some states, they do SORIs, which are sexual offense registry inquiry. So it depends on the state, but there's absolutely pretty much standard. Everyone's going to be doing background checks as part of the initial screening process. Another piece that's very helpful, and again, this is key because I think it gives you a sense of control as the prospective adoptive family, and being able to write your own story. And so the autobiography is a requirement where you can give information about who you are, your family history, your personal history, and this is a key, again, writing your medical history in there and being able to talk about, in a way that you feel comfortable sharing that information. So you may talk about some of the struggles and some of the triumphs, and where you were before and where you are now. And so again, those are really valuable information that the person doing your home study, which tends to be a social worker, will use that information and have a further dialogue with you about that. So again, a nice, that's a great piece where you can, control the amount of information and what you want portrayed. And then the next is your medical references. As part of the home study process, we require that every adult in the home has a medical reference. If you have children or in the home, we would require the child to also have a medical reference. And those medical references need to be within 1 year. So we can't have older than a year of a medical reference. And for prospective adoptive families who have cancer histories, what will be important is to have additional documentation from specialists to talk about, where you are in your treatment, how far are you in remission, How is this, and one thing that we look for is how is this impacting, or would this impact your ability to parent? And so those are key pieces that are we will be looking for as an agency doing your home study. That if your doctor's what your doctor states on those references. And another piece too is your personal references. Most agencies will require 2 to 4 personal references again, and those are of your choosing, who you'd like to sort of speak on behalf of who you are as individuals, who you are as a couple, your strengths, all those things that go into the personal reference, which we use, again, as part of the process of completing a home study. So all that information comes in our agency prior to us even getting to a chance to sit down and talk to you and more in depth and do the home study process. So this is really during the screening process that these pieces of paperwork come in, and I review, and then a social worker will come out and again start that process of a home study with you once we have those pieces in and your application is complete. Okay. In a domestic home study, we should meet with you as a couple at least 2 occasions, hopefully, if we're doing a thorough enough job. And part of those sessions as a couple is, again, we want to talk about your history. If you know, how did you meet? Have you had any other significant relationships? How do you two as a couple support one another during times of stress? How do you communicate with one another? When you disagree, how do you know that the other one is, upset? How do you resolve disagreements? What do you like to do for fun as a couple? What are some of the activities that you enjoy? And then we're also going to meet with you at least twice as individual. And those individual interviews, we're going to talk about your family history. We're going to talk about how you were raised, the communication style that operated in your family growing up, your relationship with your siblings. We're going to look at your family medical history and mental health history. We're going to gather all that information. We're going to also, another piece is that we're going to be looking at your motivation to adopt. So this is really important, and I want to underscore this, is when you're, sitting with that, if we're backing up to that initial appointment that you have with your agency or attorney. Attorney not so much, but I know an agency will be looking at this. If you are here due to infertility issues, how was that resolved? How was that loss grieved? How have you coped? And so those are pieces that are going to be really teased out in a home study. They're going to be looking for that you really took some time and thought about adoption as an option for your family, and it wasn't something that was sort of you fell into or it was haphazardly thought about, that you really took the time and thought that that this was the next best option. This was the option for your family. And so those are the pieces that, again, are going to be very important when sharing information with the agency. And then we're going to, you're not supposed to have an in-depth understanding of adoption-related issues, but I think having some sense of, what it may mean now and in the future for your child. They may want to explore your openness. Most agencies, what we commonly do is we do what's called an agency-mediated adoption. So what we will require of you is pictures and letters sent to the agency over the life of your family. And so, again, we're going to talk about how that's positive. So we're going to be sharing some information, and that gets later shared too through some education. but we want you to sort of understand, have a baseline of what you may expect in the future when you go through this process. We're going to want to look at also your stability as a couple. Who are your support system? Is your extended family supportive of your decision to adopt? Do you have other maybe families in your network that have also adopted? Where are you going to go for that support? And if you're adopting as an individual, we're going to want to know who your support network is. You know, where are you going to turn to in times where you need to refuel and you need support? So those are all going to be components, again, of the home study process. Okay. So what happens is once you have that home study complete, you're considered an official waiting family. You're considered an official approved family. So that is when your wait begins. So from that time your home study is approved, your 6 months to 2 years, that time frame starts to tick. And what happens is when you're during that wait period, what we would do is when a prospective birth parent comes forward and says, you know, I'm interested in making an adoption plan, and I have these certain criteria of what type of family that I'm looking in for my, you know, for my child. Do you have families that are waiting that would be interested or are able to meet these criteria? And what we do is we take from our waiting families list albums that may be appropriate to be able to show this expectant parent or parents. And this is what's considered the matching process. So what we do is from your home study, we take key information and we create what's called a non-identifying profile. So no one has your last names, no one has your addresses, your whereabouts. If you're, you know, from the Massachusetts, say the western part of the state, they'll maybe know that you're from the western part of the state. They will know if you're a single person or if you're a couple. They will know if you have other children or if you don't have other children. They will, if the expectant parent asks, we will share your age. They may want to know your occupation. You know, what do you do for work? They may want to know if you live in an urban setting or a rural setting. So those are pieces that expectant parents can request, and then we will start to share those non-identifying profiles, which is like an abbreviated home study with no identifying information in that. And with those, we also share what's called albums. And those albums or scrapbooks are those, you put those together as part of this process. And the albums tend to have pictures of you. If you're a couple, there's pictures of the two of you, pictures of your extended family. A lot of times our families will include the picture of their house, picture of their community and places they like to frequent, you know, their hobbies, whether it's knitting or they travel, pictures of their extended family. So all those are sort of, you can be as creative as you'd like and put in whatever information that you would like in these albums or scrapbooks. And what I always give my prospective families is I always tell them to be true to who you are, because you just never know what it is which will resonate with a prospective parent. I had a wonderful story where it was the prospective adoptive father was drinking a glass of milk. So you just don't know what it is. So don't think you need to add this or keep this out. Really just be true to who you are. You know, when the match is right, it certainly will be. You know, so this is part of how we match. And sometimes we do have expectant parents who want that traditional, the old way of doing adoptions, which was your closed confidential, meaning they didn't want to know really anything about the prospective adoptive family, and they were really comfortable with the agency or the attorney choosing the family. And so we still do a few of those. It's not common, but we still do have expectant parents who leave it up to the agency to make that decision. And when we do have that, we try to go off of what really were important, what was important characteristics for them. So maybe they were, raised by a lovely single parent, and that was something that they wanted for their child. So again, we would not share albums, but we as the agency would look at our waiting families list again and then pick the best match for this expectant parent. Part of the matching process, again, this is going to vary from state to state and agency to attorney, is that how many of these non-identifying profiles, or how many albums, how many other families am I in the running with when the match is going on? So what happens is I may pick the top 3 that I feel meet these expectant parents criteria, and I send those 3 albums out, and then she or the couple will choose one of those albums. If you're working with, say, an attorney or a facilitator, you may be one of 20 albums. So again, that's another, if we want to back up the process, that may be a good question to ask when you're going through, is that, when an expectant parent has been identified and they're looking for albums, how many other families are being sent out at the same time that I am? Because again, that's going to also impact your weight, and so again, just another little piece. So once you're matched, we are required, every state is required to do what's called post-placement visits, and so depending on the state you reside in, it's usually over a 6-month period following placement. So that social worker will be out to your home. It may be every other month. It may be every month. And they're just there to check on to make sure everyone's adjusting well, that you as a family parenting a newborn, that, the baby is doing well as far as health, that there's not a need for services or support, that the baby's growing and well and feeding and sleeping and all those. So we want to make sure we're out there and in communication with you and able to provide that support over that time period. In Massachusetts, we're only required to visit 3 times, and sometimes our legalization doesn't happen until 8-9 months into the placement, but we're not required to sort of go out and do any more visits. In other states, we just recently worked with Ohio that they want to see you out there every month until it's legalized. So if it takes 9 or 10 months to legalize, we're out there 9 or 10 times at least. So again, this is all going to vary from state to state. At the end, I've left you with some great links of where you can go on and find out that state-specific information. Okay, financing a private and domestic adoption. So we talked about that this is a very costly process, and some families will have to decide very early on that this is something that may be out of their range, that there's no way that they could possibly finance an adoption. What is helpful is there is an adoption tax credit, and depending on your income level, and it's a pretty generous income level. As of last, I believe it's up in the $170,000 range combined income. Families may qualify for the federal adoption tax credit, which was $13,360, and that was in 2011. So if we're talking about an average cost of $25,000, there's, half right off the bat that you would be eligible for during the time that you adopt. And in what my understanding is that the legalization would have to occur But again, I did put that website there on irs.gov for you to get all the specifics about the tax credit. The unfortunate piece is the tax credit was really time limited when it was put in place. And so right now it's looking to be phased out by 2013 for private domestic adopters. And I give you another link to a wonderful website that basically wants to save the adoption tax credit. But right now there's a lot of movement to try to keep that in place because it really has helped many, many families who would not have been able to go down this track if it wasn't for the adoption tax credit. If this gets phased out by 2013, this won't impact child welfare adoptions. They'll still be covered, but the amount is reduced drastically. It's going to go down to $6,000. So prior to this, even though what I will talk about in a minute, child welfare adoptions are no cost, families were still eligible for that $13,000 credit. And so, again, this was helping many, many families, and hopefully we will continue to see this in place way past 2013. Another additional financing options for adoption, what we know is that some employers have adoption benefits. And again, the Child Welfare Information Gateway is a wonderful resource for families at any point during the adoption process. And I did put that link there for you to go, and it's got just tons of resources. And one of them is finding out if your employer has an adoption benefit. They will typically cover between $1,000 to $15,000 of your adoption, which it can be quite helpful. I was doing a little Googling myself about adoption-friendly companies, and there's a whole website, Adoptive Families has it on their website, about adoption-friendly companies in this country and the support that they provide to families. So that would be something to look into for your employer to see if that is a benefit that you have. Most families use assets and credit to fund their adoptions, often paying back the money later with tax credits, tapping savings account, taking loans against, retirements and 401ks, or, tapping into some of the equity in their home are other avenues for families. There are grants and low or no interest loans. Again, I put a link there. Some of those grants are not revolving doors, so they're pretty much, the money gets exhausted July 1, and then you have to wait for another, fiscal year for you to apply again. But some are revolving, so it would be important when you go on there just to look at sort of, do I qualify? What is the process? Some of the loans, some of the grants will say that they want an approved home study before they help you finance the second part of your adoption, so you'll have to have some initial upfront costs. Some say, those families that are interested in going through the adoption process will help you from the very beginning. So again, you can go on that website or Google, even Google, you'll see some more information, but it'll be helpful to figure out, when are those time frames and do I qualify? And some banks are quite friendly in being able to give very low interest or no interest loans, so another avenue to tap into. Fundraising efforts, there have been families who, host a little events, whether it's, a dinner or cocktail hour with close family and friends and colleagues, helping them raise money to start up for their adoption. Help from family or friends, asking mom or dad or grandparents for that, early inheritance if you're fortunate enough to have a small inheritance or some money set aside. And some families really create a workable budget that they come see me, 3 and 4 years after they started this budget, and are able to, talk to me about this is the money that they have saved and this is what they can do. Some agencies as well, it's not on here, but some agencies do offer sliding scale fees. So that's another piece that you can look into when you're going down this is, based on my income, does your agency offer that as an option? Okay, any questions before we go into child welfare, anything specific on private domestic?
I don't think so.
Okay, all right.
We're good, thank you.
All right. All right, so the next part is child welfare. Every agency or every state in the United States has a child welfare agency that works with, basically is mandated to investigate any concerns of abuse and neglect of children. And those children, if the birth parents aren't able to make the changes in their life that maybe had led to the child being abused or neglected, those children become available for adoption. And on average, those children tend to be a little older and tend to be of different racial and ethnic backgrounds. When you adopt through a child welfare system, most of those kids, most of those children are anywhere from preschool up to 18 years old. There are a lot of children that are waiting. The timelines tend to be a little bit longer, and that's because most children that become involved with the child welfare system, it takes almost 2 years to go through the process of terminating parental rights and having them available for adoption. And the reason why is because the way that the child welfare system works is that we want to do everything to sort of preserve this family. We want to give the birth mother and birth father opportunity to make those changes in their life so that they hopefully will be able to parent these children or this child again. If that gets exhausted and there's no progress, then they need to go through what's called the termination proceeding. And sometimes if there's a trial, that can drag on a little bit. So people have witnesses. And so on average, it takes a child anywhere between 18 months and 2 years to have that process completed. And that's, again, the reason why the children are a little bit older. Just like in the private end of the world in adoption, agencies will do some sort of preliminary screening of you, whether it's your background checks, physical standards, it's meaning to make sure that you have, adequate space for a child or children. Health history will be important information to be gathered at this point, and will not preclude you from filing an inquiry. So don't feel that that's something that may stop you at the initial onset, that the child welfare adoption operates pretty much the same way. It's part of the process, but it's not going to exclude you. So from home study from pre-application to approval, there's a state-by-state guide, which again, a very helpful link for you to go to your state and really look at what the process entails. And this is all public sector adoptions. So you'll be able to see more of the specifics. But most agencies, most child welfare agencies operate similarly. Depending upon your state, you may be required to attend a mandatory pre-adoption educational series. In Massachusetts, we call it MAP, which is the Massachusetts Approach to Partnership and Parenting, which is a 10-week course. And so this is a course where we sort of educate prospective families on the children that are available for adoption, some of their needs, whether it's behavioral or emotional. We really talk about the impact of neglect, the impact of physical abuse or other kinds of abuse. the need to foster connections. So this is an older child who knows who their birth family is, and so part of that educational series is really educating prospective adopters on, the need for connectedness. So again, that's depending upon your state. We're again going to do those background checks and clearances. Your autobiography will be a part of your probably your pre-adoptive educational series, where again you're going to have control over those pieces that are important for you to share. Medical references are going to be very important, and again personal references, pretty much following the same process as the private domestic. The match process is a slightly different, again, because we're not working with women or couples that are voluntarily making this decision. It's primarily an involuntary process where birth parents have little control over where their child goes. So all the things that I talked about, the considerations that we would look for if we were working with expectant parents on the domestic side, really does not happen for the child welfare. It's really the social worker from the agency who's responsible for the child, so the adoption social worker will be involved in selecting you. So post-placement and legalization, typical 6 months to 2 years following placement, and that depends on legal risk. So again, if you are identified for a child who may not have had that trial completed yet, and some families are open to that legal risk, some families aren't comfortable, the time frame could drag on for up to 2 years. And then post-placement visits will vary from every month by your child's adoption social worker to possibly every other month by your family social worker. So in Massachusetts and in many other states, you're assigned your own support person. The child will have their own support person through their adoption social worker. Financing a child welfare adoption, typically no cost. They are pretty much all state agencies. There's no cost for home study, for match, for placement, and once you have a child in your care, we will pay you foster care reimbursement, which is a monthly stipend, which is not considered to be income, which is a reimbursement for the care that you're giving to the child or children. You will be eligible, or your child will be eligible for the state's medical plan, and you will receive clothing and other allowances like birthday allowances during the time that your child is there and you're considered to be a pre-adoptive parent. After the child is adopted, so during the time when the child is adopted, you may qualify, your child may qualify for a subsidy. It used to be that every child who was adopted through the state was automatically qualified for a subsidy. That doesn't necessarily happen anymore. It really has to do with the needs of the child. Again, that will depend upon your match, and it will depend again upon your state about what your adoption subsidy will look like. Typically at its max will be exactly what your foster care reimbursement rate was. Most adoptions in every state will at least guarantee you your child's the state's medical plan, which is a huge help if you are parenting a child that has any special needs and your insurance has huge co-pays. If you have the state's medical plan, that will sort of wipe away those co-pays. So those are things that you will know prior to you adopting your child. And also that you will be eligible for the entire adoption tax credit, even if your adoption was no cost. So that was another sort of benefit of going through the child welfare system, is that the adoption tax credit, you were eligible for that. Sharing your medical history. Factors that influence the way in which agencies and or attorneys make decisions. One thing that we really look at is adoptive family must have good mental and physical health, and the expectation for normal life expectancy. We really defer to your treating physician and his or her recommendation about your health and well-being. So we don't pretend that we're the experts in medical care. We certainly would not refute what a doctor said. So I think that's another piece, is that as you go through this process, to maybe let your physicians know that you're going to need this medical reference filled out, and discuss that as you go through the process. So that most agencies will absolutely defer to that. And I think what we look at here in my agency is, what is your capacity to parent? That's my number one question, is that do you have the capacity to parent? And that's really the bottom line, and when we make recommendations for approval. Conversations, so sharing your medical history. In some states, like Massachusetts, are moving towards full disclosure of adoptive parents' medical history, and not just medical history, but they're going to ask for full disclosure of mental health and age and race and ethnicity. So there's certain criteria that are coming up that we're going to have to disclose. And I think what's key is that working with an agency or an attorney who understands you, that there's a relationship and a trust that's built. And I always say, reframing the positive. It's part of your history, but it does not define you entirely. And we, as the adoption professionals, reassuring expectant parents that, a cancer history, is not impacting your ability to parent and provide loving care to a child. And I think, in gathering, because part of this process is that you will have information shared from a birth parent's history, and, sort of normalizing the experience that, there may be a cancer history in that expectant or birth parent's family. So they may have had this, whether it's on the maternal or the paternal side. So again, it's talking about it in a way that's supportive. And the key is, too, is that you having control over those aspects of your story. Just as I shared with you, is with that autobiography and the information that we share. And then my last screen is some of the helpful websites that I had referenced earlier that families can go on and gather more information. One that I didn't mention was the Tapestry books, which is a really helpful, whole array of adoption-related books for families to be able to read. And it's just an adoption website. And then your American Academy of Adoption Attorneys, it's very important that if you're looking to work with an attorney, that you pick an attorney that's recognized as having a certain level of expertise. So that's why that website is on there as well.
Well, thanks, Penny. That was
Yeah.
pretty awesome.
Yeah.
And I speak on behalf of everyone who's participated that this is really just very, very helpful. I do have one more resource that I want to present, which we'll do in a second. But before that, one of the things I just want to thank you for is for helping to put cancer in the context of this conversation. I think, as young adults with cancer histories, it feels like the odds are stacked against you, right? So you go through cancer, and it's this horrible, life-changing, and all sorts of other adjectives, challenge in itself. And then you get through your treatment and get to the other side, and you find out that your fertility has been impacted. And it's sort of the second major blow in all of this, and you're trying to move forward with your life. And then you get to a point where you need to make a choice on how you're going to build your family. And, for everyone participating or listening to this webinar, it's our hope that from this presentation you come away feeling more empowered, and that you know that you do have choices when it comes to how you build your family. A lot of times we think that we're supposed to follow a certain path or a certain trajectory when it comes to how we go about this business of starting a family. But through this two-part series, we've really tried to lay out all of the options so that you know that you have choices, and so that you know that there's support out there for you in whatever choice you make. And so, Penny, I really just want to thank you for helping to not only give an overview of both of these processes, but also address the issue of finances and other aspects of the adoption process. And as I mentioned, you put cancer into context here, and you've really given some wonderful, very helpful guidance on how we as young adult survivors can fit that into the conversation without the fear of birth parents running the other way. Because I know one of the questions we get most often about this is any birth parent going to choose me as a parent once they find out, or if they find out that I have a cancer history? And I think what you've done in this presentation has really helped us to recognize that the answer is yes. Birth parents are going to choose us, you know, and we just need to be smart about the way we go about this process and make sure that we are in control of how the information gets presented and discussed. So this really just has been fantastic. Thank you, Penny.
You're welcome. Thank you.
So I just want to give one more resource to you guys who are listening to this. Penny mentioned two things. She mentioned fundraisers, and she mentioned getting help from family and friends if you can when it comes to financing the adoption process. And I wanted to present Give Forward as a resource to you. This is just a blurb from their website, which is giveforward.com. It's easy to use. Basically enables you to set up a fundraising page that you can then share with friends and family around the country. And it gives people a way to help you, because a lot of times people want to help. And so it's empowering to friends and family and anyone else in your network, because when they say, what can I do to help, this is an easy way. Basically what it means is that you share your story and what kind of help you're looking for and why, and you send it out to everyone you know, and they send it out to everyone they know. And then in that, excuse me, hopefully you get the resources that you need and the help that you need to be able to finance this process. They have had many families that have set up pages so far. They actually sent me a link. It's a big shout out, by the way, to Kate and Ethan. If you guys are listening to this, we love what you do, and thanks for making this resource available. GiveForward.com/adoption is a good starting point. It gives examples of other families that have set up pages for this purpose, and also gives an overview of what the process entails. And as Kate had put it when I spoke to her earlier today, she said when you get pregnant, you have a baby shower, and you get all the stuff you're going to need for when the baby arrives. And when you go through the adoption process, it's not always like that, and you generally tend to need more help financially than just the bottles and the clothes and the baby gifts. And this really is a wonderful way for people to be able to help you achieve your goal of starting a family. So I'd encourage everybody to at least check it out. It does require sort of stepping outside your comfort zone a little bit and asking people you know to help you. But I think you'll be surprised by people's generosity and their willingness to help you out. So feel free to contact them anytime if they can help you or answer any questions. They're happy to do so. So with that, we will end this webinar. The recorded version of this, again, will be on our website, www.thesamfund.org/webinar. And we also ask you to fill out the post-webinar survey so that we know if this information was clear and helpful to you and what ideas you might have for future topics. What I should have mentioned in the beginning, and forgot to because I was so excited to jump right in, is that we were able to launch this webinar series called Moving Forward with Your Financial Health in early 2011, thanks to a grant from Pfizer. And we're able to continue it for the upcoming year because of a grant from the Expect Miracles Foundation. And we're very grateful for their support in being able to do this, because what these webinars enable us to do is partner with the people who know these topics the best. So whether they're other cancer organizations or professionals or just individuals, we're able to partner with them to provide guidance, information, support, and resources for some of the most common challenges that young adult survivors face. And if you have ideas for other topics that you'd like to see included, please let us know. Fill out the post-webinar survey, or you can email us at webinars@thesamfund.org anytime. So one last note for those of you who don't know, the SAMFund, in addition to providing these webinars, also provides grants on an annual basis to young adult survivors who meet 3 eligibility criteria. You can find out more information on our website, thesamfund.org. But the grant application for 2012 is posted. It will be posted through July 9th, and it's a 2-part process. There's a lot more information on our grants page, so please go check it out. As Penny mentioned, we are one of the grants programs that does not provide financial assistance on an ongoing basis throughout the year, so this is your chance to apply. As far as the family building category of grants, we do look for those candidates for funding who have already started the process or who are pretty close to starting, and with a little bit of help from us would be able to start it. So if you're not quite sure yet which way you're going to go in terms of starting a family, and you're not sure when you're going to be able to start, I would recommend waiting until our next grant cycle, next June of 2013, and applying then. But family building is one of those categories that's really near and dear to us and to really everybody, because there's nothing more gratifying than giving a grant and seeing someone be able to start a family. So we love those types of grants, but we do have specific criteria on them. So if you have any questions, you can email us at grants@thesamfund.org, and definitely check out our website. But if you've already started the process and find that you just need a little bit more help to get over the hump and be able to start, definitely fill out Part 1 of our application before July 9th. So I think that's it. Thank you guys for participating, for giving us an hour out of your Monday. And Penny, again, on behalf of everybody at the SAMFund and on this webinar, thank you so much for this. This really was so helpful and informative and just wonderful. Thank you, Penny.
Oh, it was my pleasure. Thank you.